Project Medtech.
Hello, everybody. I'm Lindsay Deneen, Director of Marketing and Engagement at Project Medtech, and welcome to another episode of the Project Medtech podcast. If we can help you in any way, or you would like to suggest a future guest, you can email us at info@projectmedtech.com. If conversations like this are helpful, that's exactly why we bring people together at our signature events, the Midwest Showcase, the Startup Symposium, and Coming to America. For more on our events that include networking, education, and pitch competitions for startups, check them out at www.projectmedtech.com. We even have sponsorship options if your company is also dedicated to accelerating medical technology to impact patient lives. So reach out today to get involved. The Project Medtech podcast is proudly sponsored by Ward Law. Ward Law Office LLC is a boutique law firm specializing in the practice of patent and trademark law. They are committed to providing inventors, entrepreneurs, and businesses of all types with personal and professional services and are flexible to meet your unique needs. It is their goal to both educate on how to secure valuable patent and trademark protection and to provide high-quality services at rates affordable to independent inventors, startups, and small businesses alike.
Today's episode of Project Medtech is brought to you by Wheelhouse DMG, performance marketing for privacy-first industries like medtech and healthcare. Every Wheelhouse client experienced record growth in 2025. That's the result of more than a decade building the data infrastructure, measurement systems, and domain expertise that healthcare and medical device marketing actually requires. Find out how every Wheelhouse client experienced record growth in 2025 at wheelhousedmg.com.
Without further ado, let's dive in.
Awesome. Chris, welcome to the podcast.
Thank you, Maureen. Thank you for having me.
And I should have better said this. Welcome back to the podcast. For those listening in, this will be Chris's first time back since he was on the podcast previously, which was episode 158, which I encourage you to go listen to because this is going to be our second part of our 5 Things You Need to Know series. And so in the first episode, we had Chris on for a lot longer. He was able to talk longer, give his background. This is going to be a little bit of a shorter episode. But Chris, real quick, not the long background, but give us the short 60-second background of who you are and what you do, and then we'll dive in.
I've been doing this for a very long time. And in particular, I've been developing medical devices for over 50 years. The last 25 years of which have been pretty much devoted to cybersecurity. So it's funny because I go into meetings with clients who are medical device manufacturers and they want to teach me about software engineering. And it's like, I know more about it than any of you. I've been doing it since most of you were before you were born. So there was a great deal of this, I understand. But these days, what I focus on is providing cybersecurity for manufacturers who need to get regulatory approval and need to get their device on the market.
Awesome. Okay, so for our little mini series within Project Medtech, it's the 5 things you need to know about cybersecurity. It is going to be, you're obviously going to give us 5 things. It's going to be a short, quick hitting episode. So let's start with the very first piece of it.
Yeah, we'll do. And this is actually a tough thing to do, is to reduce it down to 5. There is a tremendous amount of myths that come and go in this industry. It's absolutely amazing. In fact, I have written blog posts before about the myths of cybersecurity and medical devices. So it's been a long journey and difficult to actually tie down what those 5 are. But let's start with the ones I'm seeing the most frequent these days, which is the big one. Number 1, cybersecurity doesn't scale down. All right. The FDA has gone out of their way here over the last few years to document exactly what it is you need to do. This doesn't scale based upon the size of your company. Oh, gee, we're a startup. Too bad. I don't care if you've got 100,000 employees or whether you're a startup, you still have to secure your medical device. An insecure medical device in the field doesn't care what size the company is behind it. It's still vulnerable. Or the safety risk of your medical device. Because safety, and I'm going to touch on this here in the next second bullet point, but safety is a big deal and has been forever in medical device development. And that's something that gets used a lot. Lack of communications with the device, okay? but I've only got USB going in this, or I've only got Bluetooth Low Energy. Doesn't matter. You're still in this. In fact, the FDA has gone so far as to say the only qualifying attribute is you have software. So you don't need Ethernet, you don't need Wi-Fi, okay? Just if you have software, that's the only thing that matters. Ignoring security late into your development lifecycle. Well, we didn't do it when we started this development 15 years ago. I'm sorry. Gee, that's going to be really painful for you. It's also going to be really costly. And you might want to look at what else has gone into life over that 15 years, because probably your microprocessor and half your components are no longer manufactured. Or what you haven't done with devices in the past. This has changed a lot since 2013 when the FDA first started enforcing cybersecurity, especially since 2023 when they've got the congressional mandate to do this. So things have changed a lot. Basing it on some other product that was developed before 2023, I've heard people tell me, oh, it's grandfathered in. No, quite the opposite. It gets extra scrutiny because it's a legacy device. How are you justifying that it is going to be secure? So that's number one. Cybersecurity doesn't scale down.
Love it. Yeah, I actually don't have too many questions on that. It makes total sense. Give me number two.
Cybersecurity versus safety risk management. And I touched on that in number one, but it's really important to get this. Literally 90% of my clients come from large backgrounds in developing medical devices, and they understand safety risk management. So much so when they say risk management, they don't put the word safety in front of it. They're only thinking impacts to the safety and efficacy of the patient and the environment. All right, that's the classic definition. It is a well-known thing that we've used for the last 50 years. It's a process to look at that harm for patients and the environments. It's based on likelihood, probability of occurrence, probability of harm, P1, P2. Okay, it's based on the premise of naturally occurring events. Things wear out, at specific rates. Your time frame are months and years. You statistically analyze things and decide, oh, that valve is failing too early. We've got to find a replacement for that valve over months. But it can create mitigating controls. That's great. We still do safety risk management. There is also security risk management. This is defined in ISO 14971, 24971 by the FDA, by AMI, TIR 57 and SW 96. All of these standards all agree there is a separate process. It's done by different people using different tools and different timeframes. All right. It is not based on likelihood or probability of occurrence or probability of harm. Only severity and exploitability is involved, not likelihood, ever. You use likelihood, the FDA will definitely call you on it. All right? It is a process to analyze negative impacts to the manufacturer, which includes harm to the patient, but it also means if you lose intellectual property, you want to know about that as well too, for instance. All right? Financial impacts, fines, loss of consumer confidence, stock prices, loss of business. These all factor into cybersecurity, not just harm to the patient. Is it there? Of course it is. All right. Sometimes it doesn't even resonate with the manufacturer as much as loss of business or loss of finance. It assumes malicious intents and hostile environments. You can't say, well, it's going to be installed in a hospital. I get this all the time. Or it's going to be in the cath lab, so it's secure. No. Actually, you have to assume it's a highly malicious environment that everybody's going to be hacking and trying to get into your system. And instead of months and years time frame, we work in days and weeks to respond to things really quickly. And that time frame's going down, by the way. AI, which we'll touch on here in a future bullet point, but AI has shortened and compressed that time period where we used to have weeks and now we are down into the minutes. So that's number two, safety versus security risk management. Two different processes, they're different and they cooperate with each other, but neither one supersedes the other.
Okay. One quick question, because you mentioned that when it comes to the security risk management, AI is compressing those timeframes into days and weeks. Is it doing the same thing at the safety risk management level by going from, compressing that in months and years or no?
No.
Okay.
No.
Gotcha. Okay.
No. And hang on, that's number 5.
Oh, perfect. We'll get there.
We'll get to that. We'll get there.
We'll get there.
Number 3,
Yeah.
cybersecurity across the total product lifecycle. That means from the day you start your project, concept phase, and you're starting to work on that medical device as a manufacturer, all the way through approval by the FDA, release to the market, support in the market, end of life, end of support, and you're no longer manufacturing that device, there are activities you have to do for cybersecurity. In some cases, it doesn't even end with end of support. That's a real rarefied discussion we'd have to have in person, but most of them do, but not all of them. So there are things like post-market activity, security monitoring, reperformance of security testing. That's expensive and time-consuming, and you don't have the tools or the staff to do it. All right. Incident response. How do you handle attacks against your product? You have to have all this defined as part of governance in your quality manual. So you'll have SOPs and policies for this. Patching and updating. Patching and updating, and this also applies to AI, by the way. We used to have days and weeks to get a new patch out. Guess what? AI has shortened that down to minutes. Okay? The idea that this can be done starts to marginalize using patching and updates as a cybersecurity mitigation. Is it something we'll always have? Of course, because we want to be able to update the installed fleet of our devices in the field to a guaranteed assurance level. But we can't say, oh, we know this is actively being exploited, this will shut it down, because they are moving much faster than we are able to roll it out. And this involves not only the manufacturer and the V&V that has to go on to get it to the field, but then also, once it's in the field, what the HDOs, the health delivery organizations, hospitals, clinics, doctors' offices, what time delays they're going to introduce into it. Sometimes it's, hours, forget about it, okay? Days, weeks, months, years, that starts to creep in. So you have these problems that now have long time delays against an attacker who has incredibly short time delays because the tools have gotten better in their favor. So cybersecurity extends across the total product lifecycle. It isn't something you just do at one point. It's not just paperwork that you do and say, I'm never changing my design. No, it literally affects all aspects of medical device from beginning to the end of the life of that device.
Awesome. Okay, give me number 4.
Number 4, use of cryptographic primitives. The FDA is really good at asking you questions on your submission, like, how are you protecting exposure on this? What kind of encryption are you using? They say things like that. You better know how to answer that. Unfortunately, engineers aren't taught this in school. Cybersecurity is not something that is taught to engineers. So I have seen responses actually back to the FDA where those kind of questions were asked. What kind of encryption are you using? And the response in one of them, I remember, was, oh, I'm using a SHA-1. That's sort of like saying, Dwayne, what kind of vehicle do you drive to work? And you go, oh, Boeing 737. Well, they're both vehicles, but one isn't a car, okay? And the second you answer that, showing the ignorance of the subject to the FDA, guess what they're going to do? They're going to tunnel in on you because you clearly don't know what you're doing. So you need to learn cryptographic primitives. What is symmetric versus asymmetric encryption? What is hashing and what can it be used for? What are the different types of hashing, such as keyed hashing and unkeyed hashing, and how you can use them? How are key managements used? That's how I create a cryptographic key, how I use it, how I store it, how I obsolete it. All right. How do I exchange it between the important endpoints that need to have access to it? Key management, key derivation. How can I take one key and derive lower subkeys from that? All of these things, random number generation, physically unclonable functions, or what are called puffs, that are useful features inside of microcontrollers. These are very useful things to know and have available. You don't need to know how they work. You don't need to be able to build the race car, but you need to be able to drive the race car. So when you look at these, you need to understand those tools and go, I can use a keyed hashing algorithm like an HMAC to do a challenge response mechanism to authenticate between 2 points, Alice and Bob, or over Bluetooth Low Energy is a good example, where you don't have PKI, you don't have an internet with certificate authorities that you can reach out and interrogate. All right, you just isn't available. It's only the two of you, Alice and Bob, BLE peripheral, BLE central. How do you authenticate those two? Challenge response using something like an HMAC. But you need to know when to use which of those cryptographic tools for what solutions. So don't have to know the details of how they all work. You really don't, but you do need to know that they exist and what they're good for.
Awesome. I don't want to, I've already spoiled the party enough here with kind of giving away 5, but go on with 5 here.
So AI and quantum considerations. Well, AI, if you're not using it, you're planning on being obsolete next week. So everybody uses AI now. We use it to some degree for lesser or better. Some people just use it like a chat and an LLM. There are people like myself who have very sophisticated regimens and interactions with them. They're incredibly powerful. They're huge amplifiers in what you can accomplish if you know what you're doing and you have the right templates and input values and information to feed into it and asking the right questions in the right, correct way. You can accomplish way more with one of these tools. They're great, okay? And that means somebody like me who's a good guy. But what if I wasn't, okay? AI is also very useful for the attacker, and they can accomplish a tremendous amount, like I was saying with patching, now reducing the effectiveness of patching, basically removing it from the category of being a mitigation into a fleet maintenance type of operation. So AI, as we now know, can come up with vulnerabilities extremely rapidly in minutes. They can create whole new classes of vulnerabilities that you never thought about. So speed is the number one change with AI. And on top of that, we're so used to dealing with low-hanging fruit. We deal with oh yeah, here we go out and we find our vulnerabilities and we do risk management, which, let's face it, risk management is a nice way to say I'm prioritizing doing nothing. I need to justify to do nothing. So I'm going to say this is never going to happen, okay? That's what it is. Well, guess what? With AI, it doesn't care how you prioritize things. It's going to look at everything. Low-hanging fruit, high-hanging fruit, all of this is now on the table. So you can forget about scoring your vulnerabilities and saying, which ones do I have to deal with now? The answer is all of them. Why? Because your attacker is going to be using all of them and ones you don't even know about. So it's not only increased its speed, but its depth and awareness of attack methods have dramatically increased. Leverage all of that with quantum, which we're now on the brink of, which means PQC, post-quantum day. We're going to need ways of dealing with it, that we believe we have ways of preventing quantum from instantly breaking cryptography and things that we use today, we think. All right? But those have to be able to be rolled out, if not already put in place. It's also going to speed up AI even more. So we're now going to have quantum-enabled AI, and when the two of those together, that's really going to be impressive. So all of this is speeding up, getting much deeper in its coverage of what it can handle. And you have to use it today to find out what things you're missing, because you as a human being are way too slow and you're lazy and you're not going to go deep enough. So AI and quantum considerations, absolutely. Plan today for obsoleting whatever you're using here in the next 2 years because of quantum, but AI is a reality today. Use it for code generation. It's only going to get better at that. It's already pretty darn good, better than the majority of human coders. And use it as security tools. Have it evaluate what's going on. Very, very useful tool.
Awesome. Okay. Those are the 5 things. And we're in the 20-minute window here. We have 3 minutes left. This is going to make for a great article that we're going to write as well with Chris that we'll post on Project Medtech's website and beyond and whatnot. Let me ask you this. So those are the 5 things you need to know about cybersecurity to get started. If a company is starting with this right now, they're just starting out, they know this is going to be a big piece of their product, it's a connected medical device. Based on what you said, it sounds like you start from day one. Is there an ability to kind of right size this like throughout the whole process of using like a consultant?
There is. You do want us in. Some of my repeat customers have literally brought me in now because they're repeat customers, where they're saying, well, we haven't even created a prototype of this yet. And we want to start discussing what the secure topology looks like. So initially, in an advisory role, you want your cybersecurity expert to be able to come in and describe to you, this is the best way to set this up, which means he needs to be an engineer as well. Okay, not just a cybersecurity expert, but they need to be both. So I need to be able to come in and say, start doing systems evaluation in light of a cybersecurity. So you want that. If you don't do that, if you wait till the end, and in fact, I have a saying that I use with them. I say, if you're in early design phases, we're going to be best friends. If you want to ship next Tuesday, you're going to hate me, because all I'm going to do is bring you expensive, time delaying
Right.
things that are mandatory to perform. I'm
Yep.
sorry. I hate doing that. I'd much rather you come early on. Okay. By the way, I make more money if you wait till the end. So the sales part of me should say, oh yeah, wait till you want to ship next Tuesday, because it's going to cost you a fortune.
Yeah.
If you come early, it's faster, easier, cheaper. All right. It's a
question.
very minor consideration early on. So yeah, for your own sake, start this early on.
Awesome. Chris, hang on for 1 minute. We're going to chat offline here. We'll have the link in the show notes. After this gets released, we'll release a written form of this as well with Chris's support. But thanks so much for being. This will be episode like 270 some, and I know previously you were episode 158. But this is only the second time we've done our little mini series of the 5 things you need to know to start, with a specific subject like this.
Cool.
So appreciate you doing this with me today. Hang on for 1 minute. We'll chat offline.
Absolutely, Dwayne. Thank you.
Hi, I'm Freddie Coffey, Director of Marketing at Jumpstart. The Project Medtech podcast is proudly sponsored by Jumpstart Inc. Jumpstart's Trailblazer Accelerator helps Ohio's most innovative early-stage health tech startups fast-track their growth with tailored advising from serial entrepreneurs, non-dilutive funding to fuel their journey, and unrivaled access to a network of experts, resources, and investment opportunities. Whether it's improving patient outcomes, advancing digital health, or reimagining care delivery, Jumpstart provides the high-impact services and critical resources to bring big ideas to life. Learn more at jumpstartinc.org/startups.
Thank you for listening. At our core, we at Project Medtech are networkers, educators, and consultants. We meet you where you are to bring value and to create impact. We care deeply about helping medtech companies succeed right from the start, through to exit, by providing consulting and fractional services, hosting impactful industry events, and of course, sharing incredible guest insights like the ones you heard today through our podcast. Please reach out at any time if we can be of assistance. Check out our website at www.projectmedtech.com or email us at info@projectmedtech.com.